So without any further ado, I'm going to pass you over to Barry. Barry, it's over to you.
Thanks, Mohan, and thank you for everybody for joining. I've never done something like this before, so please bear with me, but looking forward to speaking to you and hearing your questions. As Mohan said, my name is Barry Causer. I'm the Head of Strategic Commissioning in the Merton Council Public Health team. So Mohan, next slide, please. And Mohan has asked me to just give a quick overview on what is public health. We're hearing a lot about public health in the news at the moment. The definition is the science and art of protecting and improving population health and reducing inequalities through concerted efforts in society. It's quite a mouthful, but there's both science and there's an art to that. And that last bit around concerted efforts, it's about partnership working. Lots of the work that I do is with other people. Key things around public health, it's population perspective. It's not just about particular service users or community groups. We have to look at the entire population within the borough. We're very interested in prevention, as everyone will know, and treatment, and looking at those inequalities. So go back one, sorry, Mohan, about improving the health of the poorest fastest. And that diagram at the bottom is really important for us, and many people may have seen that already. This is the Dahlgren and Whitehead diagram, which shows what affects our health. So in the middle, that red diagram, the things that we can't change, age, genetics, those things that we're stuck with. And then wrapped around that is the individual lifestyle factors. You know, are we physically active? Do we smoke? Do we drink too much? Do we do drugs and all those other things? But then we get into the wider circles in that diagram around the socio-economic, cultural and environmental conditions that affect our health. And there's a huge number of these. These are what we call the wider determinants of health. And if you see the green boxes on the right-hand side, the second from the bottom on the right is healthcare. Healthcare actually makes up quite a relatively small amount of our health. And I think that's why that some of our GPs, including Mohan, are real advocates on social prescribing, because these wider determinants of health, where we live, how we interact with other people, the employment that we have, the prospects, the cash we have in our pocket, makes a big difference to our health. So that's what is public health in 30 seconds. So Mohan, next slide, please. But what do we do in local government? I work for Merton Council, and it's the right place for public health to be. So the functions that we have, we provide strategic leadership for health. So our Director of Public Health, Dr. Dagmar Zuna, sits on Merton Council's Health and Wellbeing Board. So we provide those leadership skills. And again, as I mentioned earlier, this is very much about working in partnership with a range of organisations. So the NHS, voluntary sector, and our residents and our communities as well. We also commission services. We have a budget and we commission a range of different services for Merton residents. These include sexual health services, health visiting services, school nursing is commissioned by Merton Council Public Health. Then we also have the things that I get involved in around smoking cessation and drug and alcohol services. And we're going to hear from Helen from our excellent WDP service a little bit later. So we provide leadership, we commission some services, but we also provide support to the NHS. So the South West London CCG, we provide some technical support. So we look at data, we do needs assessments, we identify what needs within the borough, and then decision makers and commissioners can decide what services that they purchase. We help with service redesign, we help with guidance and notes on what works. And kind of then the last one, which is really quite apt at the moment, we have an oversight function of health protection. So this is about screening, so breast and bowel screening, immunisations, infection control and emergency planning. And clearly this is where we're starting to talk about COVID-19. And in a minute, I'm going to share 2 slides with data and information on for you. And so let's go on to that first slide, please, Mohan. So this is a complicated slide, but I'm going to take you through it as best as I possibly can. So what this slide is showing us is the number of lab confirmed cases for COVID-19 in Merton. Okay, so this is by date. So the orange bars along the bottom shows the number of confirmed cases per day in Merton. So you can see the shape of that curve. So you can see that in the middle of April there was a spike there. So you can see the cases are dropping down. And remember, these are the lab confirmed cases. There may be many other people that have been COVID positive but have not had a test. The blue line shows the cumulative number of cases. So within Merton, I can tell you that this is national data from Public Health England up to the 11th of May. Bottom left-hand corner of that is there was 675 confirmed cases in Merton. Okay, that's just a number. So when we start within public health and within the health service to compare things, we talk about a rate. So in the middle at the bottom there, you can see that our rate of confirmed positive cases in Merton is 321 per 100,000 population. And it's that rate that enables us to compare our activity to other boroughs. So if there was a very crude league table on the number of cases across London, so we can compare the cases that we have, you can see there that we would be 24th out of the 32 London boroughs. But that's a very crude measure, but what we can see is we're not at the top of, we haven't got the most cases in London and we haven't got the least. But I think the interesting thing about that slide is the shape of those orange bars and that curve. More testing is taking place, as we know at the moment, so perhaps there will be an increase in the coming days and the coming months. So that's the confirmed cases. And a very sensitive slide, we're going to go on to the next slide, please, Mohan. Lots in the press around, unfortunately, the deaths due to COVID-19. So again, this is nationally published data that I'm presenting to you here. And I can say bottom left-hand corner, there has been 169 COVID-related deaths in Merton residents. This data goes up to the 1st of May, so there's a slight lag in ONS data performance. But again, looking at that data in front of you, what that's showing you and showing us is the blue bars by day are showing the COVID-19 deaths and the orange are the non-COVID-19 deaths. So again, you can see the shape of those curves, both the total number of deaths and the blues dropping as well, so those COVID related. And we also compare ourselves, the yellow line through the middle of that slide is this time last year. So you can see how many deaths were happening per day, per week over this period last year. Really importantly, again, 169 is 169 too many. Clearly, we know that. We need to also be able to compare that number with other places. Okay, so remember that rate that I was talking about earlier. So at the bottom, you can see the rate. So this has been standardized by age. So age standardized per COVID-related mortality. So what we've seen is 83 deaths per 100,000 of the population. And again, a very crude league table of that figure would put us in the middle of a league table. What I can say is that comparing that rate to England, it's higher than England, as many of the London boroughs are, but it is better. Our rate is better, if that's the right phrase, than the rest of London. So I've shown you two slides that hopefully show the context, but again, hopefully you can see that the shape of those curves. There's a huge amount of work taking place by the NHS, the local authority, our voluntary sector partners to work and to support residents that are going through challenging times. So I'm going to go on to the next slide, if that's okay, Mohan. Because our services are still taking place. We've seen a huge number of our partners stepping up. Mutual Aid have done an amazing job. And our services are still operating, but they're operating in a very different way. Some of the services that I'm responsible for, such as One New Merton, hopefully some of you will have heard of that service. So they deliver stop smoking support. They don't deliver face-to-face services at the moment because they need to be socially distancing, but they deliver on the line, on phone and on Skype, and they're able to provide services in that way. And they've seen a good uptake of those services. WDP, you're going to hear from Helen a little bit later, a similar thing. And again, you're going to hear from Hendrik from Merton Uplift Mental Health Service. Services are still taking place. Our providers are doing a wonderful job to continue to deliver services. We've got a community hub in Merton. I hope many people have heard of the community hub. It's been well received. They're able to support lots of residents to access support, whether that's food, whether it's medicine, whether it's just to speak to somebody. And within the borough at the moment, we're having conversations about how we can sustain the benefits of that hub and continue that type of approach. And so those support services, we're working through recovery. Recovery is coming. It's going to take some time for us to get there. This what people talk about new normal. But we've seen some real innovation by our providers and the communities as well. Some of it will go back to normal, but there'll be lots of innovations that we really want to keep because they make services better for local people, whether that's better outcomes or better availability or access to those services. And again, we're seeing that across the NHS, in the voluntary sector, the borough, and also our staff. All those changes have been made enabled by staff and our residents following guidance, and our staff. So, for example, our bailiff service are going out delivering food packages, knocking on doors, making people sure that they're okay. So we've seen a huge amount of positivity from the community. Next steps. Last point that I need to make is that we're now working with our Health and Wellbeing Board. So the Health and Wellbeing Board I've mentioned before has elected members on there. It has the borough, so the London Borough and Merton. It has the council on there. It has the NHS and the voluntary sector. And we're working together as a board, so because partnerships are really important to us, and we deliver a lot of good work through partnerships to understand the impact of COVID-19. And I think there's two sides to that impact. There's the health impact of COVID, clearly, on mortality and morbidity. But there's also a real community impact of this, how we're being isolated, how we can't see our friends, how we can't see our family. So those social determinants of health, as we spoke about at the start. So that piece of work's being scoped at the moment for the Health and Wellbeing Board, and it's going to have two sides. The first is the data. So I've presented just a snapshot of some of the cases and the unfortunate deaths that we've seen. We're going to start looking at the East versus West, the differences in the data, number of cases, number of deaths. We're going to look at if there's any disproportionate impact on BAME communities, what the impact of gender is on gender and age. So we're going to start looking at the data. Well, we started looking at all the data to see what the impact is. But the second side of this is really important, and I think that's why I really welcome the opportunity to talk to you tonight. Is about the quality of voice. So it's about listening to people. It's not just about hearing, but it's about listening to people. And it's about what we're going to try to do through the Health and Wellbeing Board. We're going to co-produce. We're going to work with the community, with our residents and the voluntary sector organisations, large and small, to really understand what it's like in Merton at the moment. Because that's where we're going to be able to get some real learnings on the things that we need to sustain, the things that we need to keep, and to inform that recovery phase. So I think that's all I really wanted to say. So I've given you a bit of an overview on what public health is, what we try to do, how we work in partnership. Much of my work and the team is in partnership. I've touched on some of the cases, the data, the numbers that we have, and the services are operating. And really next steps is we want to work with the community to work out what the impact is. So last slide just simply has my contact details on. Do get in touch. I'm happy for people to contact me with questions, and I'll hand back over to Mohan.
Sorry, just unmute myself. Thank you, Barry. Really, really good. Nice overview in terms of where we are in terms of Merton, the cases and what public health is involvement in all this. So really, really good. I think some really key messages there about services are open, and I'd also want to, that resonates with NHS is still open. So I think lots of patients are not coming and seeing healthcare professionals because they're worried about getting infected, but also getting worried about bothering doctors. But you must come and see us if you do have a health condition or something which needs to be seen. I must also just ask you all, if you have questions, please jot them down in the Q&A section on the Zoom bar, just because Barry and the panel are going to be answering questions at the end. So I'm going to pass you over to Hendrik. So Dr. Hendrik Hinrichsen is the clinical lead for the mental health services for Merton and across South West London. So Hendrik, I'm going to pass over to you, please.
Yes, thank you, Mohan. So welcome everybody. I'm very happy to talk to you today about the mental health support we offer from the local NHS trust, which is South West London and St. George's. So my role for the trust is actually as the clinical lead for primary care services. So these are kind of services that people can access directly or through their GPs. So if we go to the next slide, I want to talk today specifically about support for mental health currently during the COVID-19 crisis. So I'm going to give you a brief overview over the Merton Uplift service, which is the primary care mental health service and the service that is directly accessible to people to all residents of Merton. And then we're going to talk about specific mental health support offers we have for adults affected by COVID-19. And I also want to share with you some of the mental health support options that our colleagues in children and adolescent services are providing, just to give you some practical information really to share with people you meet who may need that kind of support right now. So, and then that is the main bit. And after that, I'm going to talk to you about some of the key elements of the Merton Uplift service, because during this crisis and also after this crisis, there are a number of well-being, psychological therapy options that we always offer that are helpful to be aware of, just in case you meet someone who needs support for depression, anxiety, and eating disorders or similar problems. And then with the questions, I guess we'll wait till the end of the presentation. Yeah, if we go to the next slide. So to start with, I just want to give you a brief introduction to Merton Uplift, which is a very large volume service that covers all of Merton, is accessible to everyone in Merton, and is really easy to refer to and to get access to if you need help. So this service is an NHS service, of course, where we provide free and confidential talking therapies, as well as well-being and employment support for anyone who is of adult age and has either lives in Merton or has a GP in Merton. And what the team specialize in, so this is a large team of counselors, of psychologists who specialize really in supporting people who experience anxiety or stress, depression, eating problems, bereavement or loss, sleeping difficulties. You've got the full list here. So broadly speaking, we're supporting people with depression, low mood or anxiety disorders or eating disorders. And we also help people overcome psychological trauma. So if they have had traumatic experiences, then this service really is the first port of call, the first, the service that people should contact directly. Now, to help people with these problems, we don't offer medication, but we provide evidence-based psychological therapies. And these have kind of particular names. So these are therapies that are supported by clinical research, have shown to be effective, to make a real difference. And these letters here stand for cognitive behavioral therapy, CBT, which is probably the most widely used and prominent of the psychological therapies. IPT, which is a very different therapy, which is about interpersonal relationships and working on your relationship and relationship network. And dynamic interpersonal therapy, which is basically a form of psychodynamic therapy, so which is derived from the original psychoanalysis. But all of these treatments are available and are provided by the service, and people can access the service for appointments during the morning, the day, and the evening. So we're open from 8 to 8 throughout the week. And as probably makes sense at the moment, we, like all services, provide the support we are providing largely through telephone or video call options. We use largely Microsoft Teams and not offering face-to-face sessions for obvious reasons. Now, what is probably new about this type of service is that apart from it being, I guess, available from very early in the morning to very late, which is something that was probably not the case about 3, 4, 5 years ago, people can also make the referral to the service themselves. So they don't need a referral from their GP. Anyone in the borough who needs our support can directly contact us by literally calling the hotline number and saying, I would like to get an appointment. I would like to get some help for my problems. So it's a very easy access to this service. And then we will usually have an initial telephone-based assessment, not just during the current COVID times, but also generally, usually do the initial assessment over the telephone for 30 minutes. And then from there on, we decide together what the best way forward is. So that's a brief overview of the service. If you go to the next slide, then I want to now share what we're doing currently in terms of mental health support for adults. So we got 2 interventions that we're just rolling out at the moment. The first one is a new type of intervention. It's called psychological first aid, which we are offering we've just expanded to include all NHS staff and all care home staff who are residents of Merton. So psychological first aid is a new treatment approach supported by the World Health Organization, and it's really designed to give people the space to share some of the things that they've experienced if they had direct contact with clients who've been affected by the COVID-19 crisis. So the purpose is to foster people's coping ability, resilience building, and there's a strong emphasis on connecting with others in their social network. So there is a recognition that during these times of crisis when we're all socially isolated, it's more important than ever to stay very well connected to those, to friends, family, and colleagues. So this is now offered across all our services, and we've just expanded it from NHS frontline staff to actually all NHS staff. And for patients who would like to get this support, so who are NHS staff, for example, care home staff, we are prioritizing their treatment. So anybody who works for the NHS who comes to us will be able to access treatment within a number of weeks. The second offer is for patients who have lost loved ones or relatives through COVID-19. And for those clients, we offer a bereavement counseling offer, which can, and this is offered either one-to-one or in a group, and it could be in the form of either bereavement counseling or cognitive behavioral therapy. So the point of this work is really to help people make sense of their feelings, their very strong emotional feelings they will have as a result of someone they care about having died. And the bereavement counseling really gives you the opportunity to work through the loss and grieve the loss and process it and gradually move forward. And this is something that we also now offer across Merton and in the other services as well. So while those are the things we're offering at the moment, we are kind of considering the idea of now offering, which we started doing in Wandsworth, a wellbeing support telephone line for people who are struggling with the lockdown and social isolation, because that is increasingly becoming a need that is recognized by GPs and by people in the community, the need to have access to someone to just get some support for how they get through the lockdown, which may involve, ideas for just staying active, staying emotionally well, also connecting with others, connecting socially, and so on. So there's kind of something that we may put forward in Merton as well. That's the kind of current idea. So if we move on to the next slide. So the next slide is the mental health support the Trust offers for children and adolescents. And to get this information, we've talked to Nicholas Wilson, who's the General Manager for Child and Adolescent Services in Merton. And so the messages for children and adolescents and their parents is that the CAM services, which stands for Children and Adolescent Mental Health Services, are open and running during the crisis. And as with uplift, the main number, so most appointments are offered through video call software, and they use a particular software called attend anywhere, which is very similar to Microsoft Teams or Zoom, which we're currently using. The crisis support line is also available. That's been bolstered to account for a greater need. So there's been more demand on the crisis support line, and that's available for all clients. And for professional referrals, there is the single point of access, which is generally where children and adolescents are referred by GPs if there are concerns about their well-being. And the next slide, which you will have in your slide pack, it just shows you the contact numbers, just some practical information for the mental health support line, the crisis line, and also how to make a professional referral. And there are some other numbers here at the bottom that are also worth. These are numbers that usually are given to people so that they have a number of options of someone or a place to call in a crisis. So the Child Line, the Hope Line, Samaritans, and Young Minds Crisis Messenger. So these are obviously worth taking on board. So if you come across children, adolescents, or parents who are concerned about well-being during this crisis, then those numbers are worth having to hand to share and to signpost people to. Okay, if we move to the next slide, I've got about 3 minutes to tell you a little bit about the Merton Uplift service generally. So the Merton Uplift service, like I said, is a primary care, talking therapies and well-being service, which offers mainly psychological therapy and well-being interventions. So, and the service has 3 elements, and I want to talk about the 2 that are probably relevant to the majority of people out in our community with mental health problems. So the first one is the well-being service, which was really became part of Merton only a year ago when we went through a tender process. And so we now have in Merton a quite flourishing well-being service where we offer a kind of range of interventions effectively for people who are struggling, but wouldn't have a mental health diagnosis, but they might be struggling with work stress, they might be struggling with sleeping problems, with isolation, feeling so alone and isolated. And for all these residents, we have well-being support available. It's very easy to access it, and I'm going to talk about some of that in a minute. Then the other part is the improving access to psychological therapy service, or IAPT. And IAPT is being talked about a lot. So these are kind of services that exist all across the country in every borough. And these services are essentially talking therapy services where we offer support for people for depression, anxiety problems, and we offer that via group treatment, digital therapy like online therapy, and traditional one-to-one face-to-face treatment sessions. So, and we have recently expanded this to also include support for clients who have a physical health condition and struggle with that, such as diabetes, heart disease, and COPD, and who experience quite significant anxiety or depression because of that. So if we go just quickly over the well-being side that I want to talk about, next slide, then that is something really to be aware of. It's just the number of well-being support options we have in the community. So a number of workshops, and I've provided some of the workshop topics here that are easy to access. So these workshops run across the community all the time, and people can drop into these very easily, can book themselves onto these workshops through the website, through our website directly. And we also offer one-to-one wellbeing navigation support. So that is one-to-one meetings with a wellbeing navigator who will just be able to share some knowledge and skills around particular topics, similar to the workshop topics given here. So for the next slide, you can see the easiest way to access the Wellbeing service and the Wellbeing workshops is the Eventbrite website, where people can literally just book themselves in without even having to contact our service. So the Wellbeing service is effectively an unlimited offer, so people can book themselves onto as many workshops as they like. It's a free offer, and it's literally just a matter of booking yourself onto the workshops through the website. So I won't have time to talk about the IAP service in any more detail, but I've 2 slides down. I think I've given you some, if we go to the next slide and slide after that, I've given you here just lastly the contact number and the website address. So the easiest way to contact our service for help with low mood, depression, anxiety is to either call the free hotline number, so 0203 513 5888, or to go on our website and for people to complete a self-referral form. And then what will happen then, once we receive the self-referral form, we will contact the person and book them in for initial telephone triage. So I think that's all for me. So I really look forward to hopefully getting some more questions later on when we have time for questions.
Great, thank you, Hendrik. Really important, and there has been a few questions directed towards mental health, so we'll come back to that. If we could just pass on to Helen, who's going to be our next speaker and talking about alcohol use and misuse and what she's been seeing in her service and what's available. So Helen.
Hello, everybody. Thanks for inviting me this evening, Dr. Mohan. Yeah, I've noticed that I'm drinking a bit more alcohol during this lockdown, and lots of my colleagues have noticed the same. And we're not alone in that. I think there's been global data that alcohol sales increased globally by about nearly 300%. And certainly in March, alcohol sales in the UK grew by over 20%, which I think grew more than groceries that month. 104 million pounds was spent in the last week of March when lockdown started. And that was up significantly from the week before. So certainly people are drinking more during lockdown, or buying more at least, probably drinking it too. It's really early days in this sort of problem, because we're going to see some of the issues arising from increased alcohol use further down the line. Takes a while for alcohol use to take its toll on the body or the mind in a way that you or other people might notice, but it can creep up on people. I think Alcohol Change recently conducted a piece of research looking at about 2,000 adults in the UK, who are assumed to be kind of representative generally of the population. And actually people who were drinking the least, so people who were drinking, let's say, 1 night a week or less, actually during lockdown had cut down further still. Some were even abstaining from alcohol. So people who were, if you like, the take it or leave it drinkers, actually drinking less. However, people who were already drinking several nights a week or more, e.g. all nights a week, actually reported drinking on average about, 21% more than they were before lockdown. So it's not all bad news, because some people are drinking less, and that might be in response to the lack of opportunities where they'd normally drink. People who might drink on a Friday night after work at the pub with their colleagues, well, that's out the window at the moment, and they're not drinking at home instead of that. They're just not drinking at all. But other people, maybe people who do drink at home a lot anyway, have got more time at home in which to drink, and the environment in which they usually drink is an environment they're just spending a lot more time in. So we're seeing early signs that there are people increasing their drinking, and they're increasing it to above the government guidelines, which we know are 14 units a week or less for men and women. which isn't very much, bottle and a half of wine across the entire week. So many people are drinking above that anyway, and it looks like at least 20% of people or more are increasing it during the lockdown. Not only is that going to be having an effect on their long-term health if they don't stop drinking more, it's going to be changing things at home as well. The alcohol change survey also found that many people were reporting alcohol use at home causing more tension at home. So then we're seeing maybe some more signs of domestic violence or abuse within the homes, and maybe some more child and adult safeguarding issues as a result of increased alcohol use. And as Dr. Hendrik would know, increased alcohol use, particularly prolonged, is going to take its toll on the brain as well. It's going to affect your brain chemistry. If you're already depressed, it's not going to help. It's going to make you feel more depressed. And even if you're not normally depressed, it's likely to start making you have low mood. If you're an anxious person, alcohol use might alleviate anxiety temporarily. Morning after anxiety is going to be through the roof, and you're already going to be feeling more anxious than you would have done if you hadn't had a drink the night before. So if you're already suffering from mental or emotional difficulties, alcohol use is a sort of temporary plaster, but typically causes more problems later on. And if you haven't got mental health problems, long-term alcohol use can start to really affect the brain in ways that can lead to more problems later on. How might somebody know if they're drinking too much? Again, it's not an exact science. It'll affect everybody differently. Early signs that you may be not drinking too much are lack of energy. Maybe you're noticing changes to your skin, spottier, puffier, maybe gaining weight, particularly around the midsection, or struggling to lose weight, partly because you're maybe not controlling your diet quite so well. Sleep problems, irritability, losing focus, losing productivity, problems maybe with your bowel movements, not getting things done. And importantly, you keep thinking you're going to cut down. Yeah, you kind of noticed you're drinking more, you keep planning to cut down, but you're not quite managing it or starting to do it, or procrastinating that change. And the longer you put off making a change, the more harm you're doing as time goes on. So that's where we come in. If you so wish to seek our help, we're WDP, and we're the substance misuse provider for adults in Merton. Now, substance misuse is sort of a bit of a frightening term, and it can sound a bit stigmatizing, and people think of hard drugs, and they don't often think of alcohol, which is a mind-altering substance. It's just legal, widely available. But we support everyone, people who are drinking, not even every day, but don't like how much they're drinking and want to cut down, right through to people who have alcohol dependency and would probably need to stop completely and might need a detox. So we're helping people with alcohol use, including people who've stopped drinking and want to stay stopped. So we support people who are what we call abstinent, and they want help to stay that way. And we can also provide some medications in some cases for people to support them in not drinking again. We are typically, a bit like Dr. Hendrik's service, typically we were doing a lot face-to-face work. We've had to innovate quickly. We've gone online, and we've gone to telephone, we've gone to Zoom, and we're offering groups and one-to-ones and assessments through those methods now, including an alcohol reduction course that we've been running for 2 years. We've just moved that to be a Zoom course now instead of a face-to-face one. But we're still providing support to family and friends of people with addictions or substance misuse problems, including alcohol use, providing counselling to people who might not be able to access it elsewhere. Where we accept referrals from anyone, like Uplift. You can just self-refer to us, give us a call, drop us an email. We would say come into the service to self-refer, but at the moment, it's probably best to do it, if you can, by email or phone. And we're offering as much of our treatment as we normally would offer, except we're not doing much of it face-to-face. But where we need to prescribe somebody a medication for one of their addiction problems, such as if they have an addiction to heroin, we're still able to start a prescription for them and see them face to face with distancing within the service and all the clinical precautions. But mostly we're reducing the footfall to protect the public and our team, and doing as much online as we can. And we're going to be looking at what's working, because some of this stuff's actually, people are lapping it up. You know, people are actually liking to do some of their contact by Zoom. Some people who might have never made it in are getting assessed, which means they're getting help and they're beginning the process of change. So that's actually something we're going to be paying attention to and reviewing with Barry. You know, what's been working during this time, and what might we want to keep and adapt even when things get back to so-called new normal. Meanwhile, we're giving people lots of crisis information, lots of ideas about other online support, including things like, you know, online tours of museums, online mutual aid like AA, other forms of support they can get, such as from Uplift and the crisis cafes, and doing lots of harm reduction advice for people who are needing just to take some simple steps now to stay safe during the lockdown. I'm imagining I'm running out of time, but I'm more than happy to take questions from anyone about the services we offer normally, the services we're offering now. I did just want to go on to the next slide, because we do have a Tamil Tamil practitioner who works with our Tamil clients and actually runs a group normally, but that's being delivered through an online method now, either one-to-one or group format, for people who speak the Tamil language with alcohol problems. So we do have that for anyone who knows anyone who speaks Tamil who would like our support. I think that's it. Dr. Mohan, I imagine.
Excellent, thank you, Helen. That's been really informative and really helpful. And that last slide is just also to remind us all that the NHS is open. And so if you do have a health condition which is needing to be sorted, or you want to ask someone, then please make sure you do ask someone, because we're here to help. We've got some questions which have come through. So I'm going to ask our panel some of these questions. And the first one goes to Hendrik, actually. Hendrik, there's a question here about mental health referrals.
Yeah.
And are they still open for referrals? Could you let us know if they are?
Yeah, I think all our services are open to referrals, to new referrals. And I think, you know, it's fair to say the referrals have dropped off a little bit, maybe quite surprisingly, because maybe people, like your slide here just indicates, are just not sure whether we are kind of open for business, but we are. And so we are assessing and treating, and we're kind of, you know, absolutely happy to receive referrals, and for people to self-refer, to contact us directly, contact the admin team, get an assessment booked in, and take it from there. So I think it's an important question, because I think there is some kind of sense that everything is on hold, and it's worth reminding people that it's all, I mean, our teams are working to the full extent. They're just doing everything online. And we've been able to move everything to online really quickly.
Excellent, thank you, Hendrik. And I think that echoes what we're all saying, that the NHS is open and other health services are open. And I think webinars like this also highlight the self-referral route. So if you have a colleague who is suffering or needs some support, then please give them the numbers so they can, you know, find out for themselves. They don't necessarily need to go and see a clinician, they can support themselves. So yeah. Thank you. There's a question on, will we be able to get the slides? So the actual YouTube and the presentation will be able to view again. So yes, you can get the slides and the presentation, that's fine. Barry, I think there's a question here for you. I live with a high-risk person with multiple health conditions who has received a letter to advise them to stay in and shield. does this mean I should not go out at all? Are you happy to answer that one?
I am, yes, and I think that there's been two questions related to the shielding service. So the shielding service is something that's been put in place to shield and protect the most clinically vulnerable people in the country. So the first question was from Doris, I think it was, and this was a question about leaving to go out just for a few minutes because she's been staying at home for 8 weeks, which is a really long time. And Doris, you're doing a wonderful job by shielding. So well done to get that far. It's really difficult, but we strongly advise that those shielding people do stay shielded for 12 weeks. It's incredibly difficult to stay at home and not leave. And perhaps Mohan could come in as a clinician to answer this as well. But stay at home, stay safe. But what we are seeing as well, if you perhaps like going out and going to the theatre, there's some really interesting things being delivered online at the moment. Clearly, you're on a webinar. The National Theatre are publishing every Thursday. They publish different shows. So these are full performances by world-leading actors online. So there are lots of other ways. You can get dressed up, you can pretend to go to the theatre, and you can watch it on your TV at home. But I would suggest the advice is really strong that you should be staying at home if you can. Mohan, I'm not sure if you've got anything to add before I answer the second question on shielding.
Yeah, no, I think that's exactly it. The shielding group are those high-risk groups who are at greater risk of contracting COVID and therefore suffering, and therefore they need to shield away for 12 weeks. And unfortunately, it means just that. And so there's no. The advice is that we do shield for that period of time, and there is no other sort of way around that. I think anyone else can social distance and try and reduce the risk of passing COVID or even catching it. The problem is other individuals outside who may be asymptomatic and not have any symptoms, and that may pass that on to you. So that's all I'd add on to that.
Thanks, Mohan. And the second question was from Faye. Faye, by the looks of the question, is living at home with someone who is shielding, but Faye herself is not. And so, yes, she's allowed to go out. She's allowed to continue, but she should really make sure that there's some real clear guidance and evidence on the website. And so, Faye, what I'd suggest is if you email me, my email address is on the link. I can email you a direct link to the guidance, but you are able to continue and do your things, but there's some really important guidance on making sure that you follow social distancing in the household, so minimizing your contact as much as possible. Again, we know it's going to be really difficult. We don't all live in massive houses where we've got different wings of the house and we can do all those different things. It's really challenging. But as Mohan said, as a GP, we need to protect those shielded people. So you are allowed out, you are able to continue doing the things that you want to do, but be really mindful of social distancing for us, please.
Thank you, Barry. Alex just messaged me to say that if you guys do want the slides emailed to them, then please message Alex privately and she'll be able to email you the slides afterwards. There is another question here from Geeta, who this might be for Hendrik, actually. We were told that South West London were due to launch a website soon for those with long-term conditions. Do you have a launch time for that?
Yeah, there won't be a specific website for this. I think there will be a page on our website with some information about support for long-term conditions. We are currently out in the practices promoting, and the best way to access that support is just simply by contacting the service at the moment. So if you contact us, you want support, you have a long-term condition, and also problems with depression, anxiety related to that, then the three conditions we focus on is diabetes, heart disease, and COPD, or respiratory problems. So just contact the service for support and we'll direct you then to the right, there's a specific assessment that's done, and then there's specific, there are a number of clinicians who specialize in that approach and will provide the support.
Excellent. Thank you, Hendrik. Listen, we're coming to the end of our hour, and I think that's been extremely useful. I wanted to ask each of the panelists just to give a little summary, a 1-minute summary of everything, if they wouldn't mind. So, Helen, I'm going to ask you just to leave us with a minute sort of overview summary, please.
We're still open.
Yeah.
You can still get help. It's never the right time to make a change, but you could just make a decision to do something about it now, and get in touch with us. We'll accept a referral from anybody.
Excellent. Thank you, Helen. Barry, can you just leave us with some tips in a minute?
Thank you, Mohan. I think it's again, as we've kind of covered on the shielding stuff, you know, it is really difficult at the moment. We know it is. It's difficult for us. It's difficult for many people. We're all dealing with this in different ways. Try to help each other. You know, we've got some really strong services like Merton Uplift. We've got WDP. We've got those things. We've got a thriving voluntary sector in Merton. The community hub is great. They are able to take your calls if you need advice and support. They can then signpost you on to the appropriate level of support. You know, even if it's just having a quick conversation with someone to say, how are you feeling? How can we help you? So the services are open. And again, there was a question that came up previously about, you know, the non-COVID curve on this one of the slides that I presented seems to be the same shape as the COVID curve. Why is that? It's complex, but perhaps one of those reasons is that people aren't accessing NHS services when they really need to. The NHS is open, the voluntary service is open, so ask for support, and we've got a good thriving sector within Merton.
Thank you, Barry. Hendrik, do you want to leave us with some wise words?
My top tip is, I mean, we've been discussing this a lot in the team about, you know, what are the kind of things that we should be doing? What are the things that we're doing as kind of people who work in this field? I think there's something about really staying socially connected that is coming out as the most important thing. And I think we're in a great time now where we have so many options in terms of video software like this, you know, to stay connected with people we care about. And we personally, we've discussed that reconnecting with people we haven't spoken to for a long time, speaking regularly with family, friends and colleagues, and even among the team, we're kind of regularly checking in how everybody's doing, and that just really helps, you know, and that's just relevant for all of us. And I think for our service, we've got a great wellbeing support team, you know, and we're very easy to contact. So for people who might hesitate to pick up the telephone, the easiest way to really get in touch with us is just go to the Merton Uplift website and fill out a self-referral form. And then we will take the initiative to contact you and to make sure you get the right support that you need right now. So people should not be suffering in silence, but if nothing else, complete a quick online referral form. It's really quick, and you don't really have to do much more. The rest will then be done by the service. And you can always say, no, I've thought differently. I actually don't want any support right now. But taking that initial step is often better than just not doing anything when you really do need help and support and you're struggling with your mood.
Thank you, Hendrik. I mean, my tips are, you know, we're social animals, and I've been really amazed as a GP how our communities have come together, and this is a fantastic example of how we're supporting each other, and actually we're identifying what our resources are, and I hope we continue to do many more. You know, stay connected, stay safe. The NHS is open, and I look forward to future ones of these webinars. And I'd like to thank all our speakers, so Hendrik, Barry and Helen, for speaking today. It's been really, really helpful. And also Raheem and Alex, who are behind the scenes or in front of the scenes in terms of mutual aid, doing all the work they're doing, because without that, you know, a lot of work's been done. So thank you.
Thank you for organising one. Brilliant.
Thank you all.
Of course, thank you for Dr. Mohan for sharing it all for us.
Yeah, thank you, Dr. Mo. Take care, everyone.
Take care. Stay safe.
Yeah.
Take care, everyone.
Thank you.
Bye.
Bye.